A village in the central part of Cameroon. The subject is prevention and treatment of diabetes, and people listen carefully. Most people in rural Africa rely on the local healer to keep them healthy. So people with diabetes may be left with wise words and dry leaves to stop a silent killer. We meet Ulrik Udal Nielsen from the World Diabetes Foundation. He is here to talk to patients and to meet the health providers.
Welcome to the traditional healing home here. And here, this is my first place. This is where we carry out treatment. This is where, just like a lab technician, this is my laboratory.
This is your laboratory.
This is where I diagnose my problem. That is my shrine. This is where, we converse with ancestors. Mm-hmm. There are so many things that we do here. That's why you look at it, it is purely traditional.
I'm a diabetic.
Right.
I am, in my language, type 1. I don't know what you call it in the traditional, no, if you make any difference.
In my language, I don't think we have type 1, type 2. We just know that it's diabetes.
Okay. If you don't get insulin from your diagnosed, you say that within 1 week you will die of it. What will happen if somebody comes to you?
I first of all give you the first plant. If it doesn't respond, to you well, we take the second. Yeah. The patient has been there for some time, and I don't seem to see progress. We drive the patient to the hospital, make sure we take care of the test.
My experience is that the more you get out in the countryside, the more the population also speaks the language of the healer.
80% of the population in African states consult traditional healers.
The World Diabetes Foundation is now collaborating with the traditional healers to ensure immediate treatment of people with diabetes. Misconceptions are very real barriers. The World Diabetes Foundation has established a number of clinics in Africa to help the estimated 13.6 million people with diabetes. It's time for the clinics in Cameroon to be handed over to the health authorities. Ulrik is here to find out whether they are ready for the transfer.
You have to meet the people. You have to also to be there to be able to understand what the problems are. You can't do that on a piece of paper.
Okay, and this is the waiting room.
A survey in Cameroon, supported by the World Diabetes Foundation, has revealed that every fifth inhabitant in the country is obese, with even higher frequency in the urban areas. Almost 6% of these people have developed diabetes.
The facts of diabetes in Cameroon is that about 5.7% of the adult population living in urban areas have diabetes. If nothing is done to curb down this risk factor, like obesity, it means that more and more people will develop diabetes in Cameroon, and it will become a national catastrophe.
Le diabète rend aveugle, n'est-ce pas? Le diabète abîme le cœur, n'est-ce pas? Le diabète abîme les reins. Voilà. Le diabète fait même qu'on ampute le pied. Donc le diabète abîme le sexe. Donc ça fait trop de dégâts. Quand vous attrapez une maladie à cause de l'obésité, c'est mauvais. Voilà.
Kevin is patiently waiting. He has type 2 diabetes. It's a condition that is normally associated with much older people.
Kevin is a typical example of something that is going on. We are seeing a growing epidemic of childhood obesity, and this has consequences in terms of metabolic diseases, in terms of diabetes. We really need to emphasize our prevention program in order to avoid this thing to become a type 2 diabetes epidemic in the developing world.
Is that the individual consultancy which is taking place over there?
Yes.
Okay. The good thing about this center, which is really the way we like to see it also, is that it is sustainable. We come in and we give you some funds to renovate and give you some of the equipment, but all the staff here is permanent staff.
Yeah.
As such, it is sustainable because it's running.
Yeah.
Garua, a city in the northern part of Cameroon. Here, obesity is seen as a symbol of a prosperous and healthy family. Today, Georgette is a widow, and she has type 2 diabetes.
Le diabète est une maladie difficile parce que tu perds l'appétit de tout. Avant, je m'inquiétais beaucoup. C'est comme ça. J'étais mal à l'aise. Les premiers jours, je n'étais pas en moi. Mais après, quand j'ai regardé les recommandations qu'on m'a données, de ne pas manger ceci, de ne pas boire, je vois que maintenant, c'est mieux. Et puis, je perds mon poids, je suis à l'aise. Quand tu étais mince, on disait que oh, tu as eu les mauvaises maladies, tu as le sida. Mais tu maintiens ton gros corps. Mais finalement, on a vu que le gros corps, c'est rempli de maladies.
When you have to fight diabetes, you know that diabetes per se is only an increase in blood sugar. What actually kills in diabetes are the complications of diabetes. And if you have a healthcare system like the one in Cameroon, which is not well developed in terms of free access to health for everyone, free medication, it means that people will not be able to source treatment early enough. It means they will develop complications and they'll have kidney, eyes, heart complications, and diabetic food. These are the things which are extremely expensive.
Je suis prisonnier parce que je ne peux pas manger n'importe quoi. Comme maintenant, je suis ici.
India, Madurai on the southern tip of a huge country. Here, many people find it difficult to keep their diabetes under control. Once every month, a group of volunteers help them at the local temple.
மாதம் போகிறது இந்த வருஷத்துல தான் போகிறேன். ஏற்கனவே செக் பண்ணுவேன், கொஞ்சம் குறைஞ்சிருக்கும், அதனால் போகிறதில்ல.
Patients are also offered to have their eyes checked for cataract and retinopathy, a common complication with diabetes. Untreated, it can lead to blindness. The World Diabetes Foundation supports the mobile clinic, which uses advanced communication tools to reach thousands of patients with precise diagnosis.
Patient is taking photo now. Photo will send to Aravind Hospital, Madurai by satellite. The doctor will grade the photos.
The picture shows a potential retinopathy in his eyes, but it can be prevented.
செக் பண்ணி பார்த்ததுல இப்போதான் பாதிப்பு வந்து லேசாக தொடங்க ஆரம்பிச்சிருக்குது. நீங்கள் மேற்கொண்டு என்ன பண்ணணும்னா சர்க்கரையை வந்து நல்லா கண்ட்ரோலில் வச்சுக்கிட்டு நாங்கள் சொல்கிறப்ப 4 மாதம் இல்லை 6 மாதத்துக்கு ஒரு தடவை வந்து மதுரை அரவிந்த் ஆஸ்பத்திரியில் கண் நரம்பு செக் பண்ணி பார்த்துக்கிறணும். சரிங்களா?
Healthy food and more exercise will reduce the need for giving his eyes laser treatment in the future.
ஏன்னா அவங்க கேம்பில் என்ன சொன்னா தானே நம்மளுக்கு தெரியும். அதனால் அவங்க சொல்ல போய் அது பிரகாரம் நம்ம நடந்துக்கிட்டோம். அவங்க சொல்லலைன்னா நமக்கு ஒன்றும் தெரியாதுல்ல.
Back to Cameroon, Ulrich meets more patients.
Oui. Est-ce que moi je peux vous poser une question? Vous voyez beaucoup de diabétiques qui ont des problèmes de complications à cause de diabétiques avec les yeux ou les pieds ou... Vous les avez tous. Je viens de quelque chose qui s'appelle la Fondation mondiale de diabète. Nous avons financé des cliniques de diabète à Yaoundé, à Bamenda, à Douala et à Garoua. Ici, vous avez des questions?
En vous disant qu'on a comme l'impression que le diabète n'est pas autant suivi que d'autres maladies, par exemple le VIH-Sida, et que franchement, je suis un peu déçu devant cette situation. Nous luttons de toutes nos forces au quotidien pour survivre. Les remèdes sont chers.
Oui.
Alors comment nous pouvons faire ce suivi?
Yeah. What I get for them is that I get an impression that we're doing a lot of the right things.
India. Pregnant women are invited to come to a free blood testing in Chennai. 2 out of 10 pregnant women in Chennai develop a temporary form of diabetes, gestational diabetes, without knowing it. It is important to find the women at risk as early as possible in pregnancy to save both mother and child. The project is supported by the World Diabetes Foundation. A simple blood test is able to determine who needs to come for further control at the clinic. The next day, Mrs. Flory returns to the clinic for further testing. She may need to go on insulin.
அந்தம்மா ஒன்று வந்து நீங்கள் உங்களுக்கு நேற்றில் சொன்னதுலேருந்தே கொஞ்சம் மனசில் இருக்கலாம், பயப்படுறதுக்கு ஒன்றும் இல்லை. ஃபஸ்ட்டு காமாக இருங்க. இப்போ ஃபஸ்ட்டு வந்து மீல் பிளான், இப்போ டயட் சார்ட் பற்றி சொன்னேன் இல்லையா, இதுதான் நீங்கள் வந்து ஃபஸ்ட்டு பண்ணணும். ரெண்டாவது எக்ஸசைஸ்னால் ஜஸ்ட் ½ hour வாக்கிங் எவ்ரிடே போதும். மூணாவது தான் இன்சுலின். இந்த இன்சுலின் வந்து காலையில் 6 units, நைட்டில் 8 units, ½ hour before food. I wish she had come early so that we could have, prevented so many more other complications which can occur towards the end of pregnancy. But then, what happens if Flory did not come even for this test? I would say high chances of her to lose the child. She's been lucky, though she's been late. We have at least found her now, and we are going to start treatment immediately.
In Cameroon, mothers have gathered at the Etug Ebe Baptist Health Center. It's time to have their newborn babies checked. A perfect opportunity to tell them about diabetes.
What's the general factors then? When they cause, when they expose we for get this diabetes. We know how long have we avoided diabetes.
It's really the long-term kind of prevention that we also like to see. Because if we can avoid people getting the disease, it will be much easier than if we have to treat them once they got the disease. We visited a lot of clinics. I've told them I'm here to listen, I'm here to try to understand what your problems are. So fire at me. And I also think I know what we're talking about because I'm a diabetic.